Hello friends, we have a special guest with us, Mr. Shelton, and he is from South Africa. There are a lot of questions asked initially. Can we do a curly hair transplant, a very curly hair, round hair? Is it possible to extract them safely? Is it possible to implant them safely? So the answer is the technique which is important, how we extract. Generally, when we see people doing FUE, they have a straight drill. It can't go and curve inside and take the hair out. So when there is a curly hair, there is high chances of damaging, or the extraction will be very low quality. So when we do a strip surgery, we extract the hair and divide under the microscopic magnification, and then we can preserve each and every hair, and because of that we can get lot of hair, less damage rate, lot of area covered. And on top of it, if we organize it in an artistic manner, we get extraordinary results. So we have done surgery twice for him. One surgery 2018, one surgery 2019. Both are strip surgery combined with little bit of FUE. Mostly we did front in the first session, second session after 1 year to mid scalp and the vertex, and here are the results. How are you?
I'm very good, thank you.
So we are really proud of you, and you are our poster boy actually. So a live example of curly hair transplant with excellent outcome, and we are really eager to know your story. In 2018 you emailed me. How was your previous journey of hair fall and how the things were? Please kindly introduce yourself.
Okay, hi, I'm Sheldon, and
You're from which city of South Africa?
South Africa. I'm from Pietermaritzburg, South Africa.
What's your profession?
I'm a teacher.
Good.
And yes, it was very difficult because as I got older and my hair started falling.
You're still young. Not old.
Well, I think I actually started losing my hair at a young age. I think I started noticing around 23, 24. I started noticing my hair thinning quite early. And then I would get comments and insults, and it really damaged my self-esteem. So I decided to do a hair transplant. I did lots of research on YouTube. And I emailed the first doctor, and the response was no.
Which country was?
Turkey.
So mostly when we see these type of rankings, obviously everybody will call the first surgeon, thinking that he is the best possible thing.
Yes.
So first email and the response was?
No.
So do you thought of getting a no response from the top class surgeon ranked in the internet?
No, I couldn't believe it. I was actually disheartened. I didn't expect no, and that really damaged, my hopes.
Did you find me also in the list?
Yes, your name was on the list, but it wasn't first. Maybe it was alphabetical. Maybe Dr. Sony was lower down. I don't know.
Which rank I was there?
No, you were quite high up. You were one of the surgeons that were there on the list.
Okay.
But when I opened up this list of international renowned surgeons,
Very good.
I started on top, and then I worked.
So this is the
down.
way we should work for. We should take the opinion from past patients, the good forums, and they recommend the list, and obviously go one by one with every surgeon, ask how they are performing, what is their opinion about you, and what results they expect. So first surgeon was out.
No, he said he cannot help me because my hair is too curly. I think he was only doing FUE.
Oh.
So because of that process, he said no. There were a few other surgeons, maybe 3 or 4 other surgeons I tried afterwards. Very disheartened. I actually gave up for a few months. And then I decided, no, I'm going to try again. And then one of the surgeons I emailed after that was Dr. Sony. And he gave me a positive response.
First shot.
Positive. Come in.
I didn't believe that first top surgeons no, and from the bottom list, Dr. Sony, you say yes?
Yes, I couldn't believe it, but I was so desperate. I really wanted help.
Yes.
So I came through. I'm really glad and happy I did come through because I'm so pleased with the results.
So at least first thing, you wanted your hair back.
Yes.
So when did you come here and you had a consultation with me?
Yes.
So what was my opinion about you? What procedure and how do you think it was different than others?
You suggested FUT procedure. We take a strip, and when you explain that how you preserve most of the hair follicles in that process.
Microscopic dissection, under vision cutting with a proper technical expertise.
Yes. And I decided to go with that. I was very pleased the way you explained it and you reassured me. So I was happy to go ahead.
Nice. So in 2018, the procedure was seamless, pain-free and comfortable.
Free, comfortable, no complaints.
Absolutely. Any complications, the strip surgery, many of the people are really afraid of the stitching part, the cutting part, neck stiffness. Where you are not afraid of that?
No neck stiffness. I was a bit nervous about the scar, possible scar, but I was also really wanting this procedure. And when I saw your videos of how the scar was so minimal.
After 2 or 3 or 4 months, I went to my barber's. He said, my barber should have noticed that there's a scar at the back or there's something. He said, nothing. Your trichophytic closure again is a great artistry, and because you're a plastic surgeon, I don't think lots of people can make that kind of closure.
It's a very fine artistic work, around less than a millimeter of epidermis and dermis, less than a millimeter, which you have to make a step and then close it.
I was also reassured.
So how was the outcome of the first surgery?
Very good, really good. Then I came back because then I wanted a bit more coverage around the vertex.
So we did it again?
Yes, you did again.
So a strip surgery can be done again, isn't it? It's based on elasticity. Your elasticity recovers. Skin is a property that elasticity recovers back in a year or so.
Sure.
And you can re-extract a strip. And best part is, I will not leave 2 scars on behind.
We'll want the same scar.
I will include that scar in the strip. So finally there will be only one scar.
Oh, fantastic.
Again, with the trichophytic closure, it's almost negligible.
Yeah.
And again, you get a lot of hair from the safest area. A small surface area is utilized and we can cover a lot of area. So this is the commonest misbelief that strip surgery cannot be done again. So we did that again, same surgery. How was the procedure in the second surgery? Pain, comfort, recovery, and complications, what do you feel?
No complication, no pain, same like the first procedure.
So we did cover the remaining part.
Yes, you can.
And now you are fully covered.
Yes.
That's nice. You are looking very good, very fit, maintained, and now very young with the hairstyle. You are carrying very handsome. And congratulations for that.
Thank you.
And you see the design, the hairline design, which I work passionately to create a natural design. Every time and every video I work hard to tell, yes, design matters a lot. So how is your design? Because every face is different, every continent face is different.
Yes.
So you are from the different continent and to think out of the box that this is a different face from different continent. Design should be different, hairline should be different, angulation of hair, pattern of hair, position of hair should be different, but it should be natural. Natural in my sense that when you go back to South Africa, nobody should say it's a transplant. So how was the reaction of your friends, family? Does they recognize it's a transplant, or does they say that it looks unnatural? And what's their opinion?
At first, well, they found it difficult to believe, but besides the people at my family and, everyone else that I've met, nobody has asked if it's a transplant, nobody thinks it's a transplant.
Is it?
Yes, so I'm very pleased. When I look in the mirror, it doesn't look like a transplant.
For you also?
For me, I know you go around, and because I've been through the procedure, I've watched so many YouTube videos, I can see transplants a lot of the time.
You can recognize
Recognize the transplant when it hasn't been done as professionally maybe. You see a transplant, so I'm really pleased with that.
Absolutely perfect. And I'm really pleased and really happy to see you back with natural results. And this is what I look for.
Yes.
This is what I work for. Precision in designing, precision in outcome, precision in personal satisfaction, patient satisfaction. So I always make sure that outcome should be absolutely natural and up to the mark, pleasing to the patient, and it changes the lifestyle of a patient, confidence building. Now hair is out of your mind.
Yeah.
That is the thing which is wrong.
Yes.
It should not be hindrance in your profession, in your family life, in your social life, in your confidence building. So very good. I'm very happy with your outcome and very pleased. Best of luck for your life.
Thank you, doctor.
Thank you. For more information, go to our YouTube links. We have detailed information of this subject on my YouTube videos.